Welcome to the Wellness Dentist Podcast. Join biological and cosmetic dentist Dr. Katie Toe as she explores holistic wellness through trending ideas, real stories, and patient experiences. This podcast will inspire you to make healthy lifestyle choices and take charge of your dental wellness. And now your host, the Wellness Dentist, Dr. Katie Toe.
Welcome to the Wellness Dentist Podcast. I'm your host, Dr. Katie Toe, and today I have a special friend that came in all the way from California to the Beyond Biohacking. And as a fellow biohacker, a fellow wellness dentist, I have a huge honor to interview Dr. Jennifer Wu. Welcome to the show.
Thank you. I am so glad to be here. It's a really exciting opportunity.
Yes. Are you having fun so far at the conference?
Yes. So many different things that I have never seen and just introduced to now.
Yeah. It's like a Disney Wonderland for adults.
It is Disneyland.
Yeah, for biohacker and health and wellness enthusiasts. So, first of all, I know that everyone on this show, since it's a Wellness Dentist podcast, how do you start on this wellness journey?
Yeah, so great question. It started a long time ago. I thought I was doing everything right. I'm working out, training for half marathons. I'm going to my health exams once a year. I thought I was eating healthy, and then I'm pregnant. And in my third trimester, I go to my wellness exam, and then I walked out with the diagnosis of preeclampsia. So what that meant was my blood pressure was dangerously high. And so they put me on bed rest right away. And I was not expecting that. Thankfully, the delivery went fine, but the blood pressure never went back down.
Even after the delivery?
Yes. So it stayed high. And then my doctor said, you need to get on blood pressure medication. And we don't know why, but just expect this for the rest of your life. So I was so confused and feeling really defeated because I thought I was doing all the right things. And I thought blood pressure medication was for older people like my parents, not someone like me. I'm in my late 30s. I'm feeling great, I thought. And instead, they just told me that, my body's broken and you just give me a prescription and a shrug. So that went on for a while until I was introduced by a friend to a functional nutritionist.
Yes.
I didn't even know what that was then, but they said she does a deep dive on your blood panel. So we tried that, and right away she said, your blood sugar is a little bit high, and I think this is what's driving your blood pressure, and you need to get this under control. For the first time, somebody said there was probably a reason.
Yeah.
So I knew I had to do something about that. So we worked together. I started tightening up my nutrition, started working out more, and then really started doing things to care for my body. And my blood pressure actually started dropping. My A1C has actually dropped to, I'm almost there, not quite there, but getting close.
Yeah.
So with this experience, that pretty much told me that our healthcare system is broken. And
thank you. You hear that? How healthcare system is broken. We usually call it sick care too.
Yes. Yeah. So to me, it's sick care now.
Yeah.
And because they just wait for you to get sick, symptoms appear, and then they manage your disease. And I feel like things happen for a reason because then and ththings happen for us, not to us.
Yes.
Because at that same time, I found you, and I started listening to your weekly messages, sharings, and then I thought, I can't go back to dentistry doing it the same way because you made this mouth-body connection that they didn't teach us in dental school, not to that degree, and it was just so eye-opening. Once I saw that, I couldn't unsee that, and so that's when I knew things had to change. I went back to the office, and we now do things differently, make that connection, and it's just more in alignment of why I went to dental school and what dentistry should be for our patients.
Yeah.
So.
Is that shocking to hear that we are healthcare providers and professionals, and when someone mentions functional nutritionist, and you're like, who's that?
Yeah.
Right? Mm-hmm. Because we did not get a lot of nutrition class.
None.
Depend on which school you go to, but I don't know any dental school really teaching nutrition the way that using it is healing and medicine. right? Besides follow the food pyramid, which is we know is all wrong.
Right.
And we're not supposed to eat based on what everyone else eat. It's have to be personalized to
Yes.
your blood type, your gene, also your goal, right? Some people want to build muscle. Some people want to, have more flexibility or building bone.
Yeah.
And so it's crazy for me to hear even healthcare professional are being treated just like, a number.
Yeah.
Like you are a professional and you went and the doctor's just like, well, just take medications and then that's all we can do for you.
Right. Right.
Yeah. And did you have any side effect when you're on high blood pressure medication? Because a lot of people do.
I didn't,
Oh,
actually.
thank God. Yeah. And you did not stay on that too long.
No, I was, for a long time. So about 15 years. So
15 years?
Yeah, it took 10 or 15 years before I met the functional nutritionist. So
Wow.
yeah, it's been a long time.
And I have to say, because of your lifestyle choices, right? You're working out, you're eating right, you're cooking at home. That also helped. But to a lot of people, the side effect got worse with the lifestyle choices.
Yeah.
Like the regular, we call the standard American diet. It's actually make it way worse.
Right.
But 15 years is a long time.
It is a long time.
On a prescription medication.
Yes.
Yes.
So
Wow.
I'm looking forward. I'm so close. So they've already started adjusting it. So I'm looking forward to finally being off of meds.
Yeah.
Yeah.
And hearing that story as a patient, knowing you started this wellness journey of your own story, it's super powerful. Because to me, if you just say, I came back from conference and I'm start doing it now, it is not as, wow, I've been through this for 15 years as a patient and I know there's more can be done than just taking the prescriptions.
Right.
Or taking the teeth out when you can do a lot more decades ago.
Yes. I already felt like I already know what it feels like to be a patient where doctors don't really give you an answer, don't even explore why they don't ask those questions. And if they took the time to ask and
they stopped trying.
Yes. They just gave up. They just said it was normal, and we already know normal is not optimal.
Yeah. I totally, and we also normalize that.
Yes.
Sickness. Oh yeah, I thought everyone having high blood pressure medication. You see multiple patients have multiple high blood pressure medication because one didn't work. They stack another and they stack another.
Right.
Yeah.
And patients have accepted it. They just have said that, it's just normal. It's genetics. I'm just going to be on meds. It's fine.
Yeah, they stop asking, right? Yeah, I noticed that. They accepted it as a norm. Yeah, the new norm of being sick.
Yeah.
So when you bring that wellness from your personal experience into your practice, what changes did you make?
So we do our exams differently now. We don't just look at teeth. We make the whole body health connection. So we look at the patient holistically. We ask questions that I used to not ask before, looking at their pH, their nitric oxide. We even, I told them to even bring their blood work in.
Yes.
So we review that.
Not many dentists know how to look at that and even ask for it.
Right. And they always look at me funny when I ask for that, patients. We talk about supplements, nutrition. That's so important. So vitamin D levels. Again, patients are always confused why I'm talking about vitamin D. And we also look at airway and gut health, bacteria, talk about that connection to the rest of the body. And it's been just much more alignment of what we're looking for patients' health.
Yeah. And I'm sure your new patient as well, your existing patient was like, wow, what's going on? New patient, I think that a bit more open.
Yes.
Because they have not experienced that before. But I think existing patient was like, well, I saw you a year ago or 6 months ago. You didn't do that. How do you respond to those comment or those questions?
Well, I tell them when we know more, we do more.
Yes.
And I'm learning these things and I want the best for your health and I'm doing it for myself.
Yes.
So I want to make sure we're covering all the bases and your doctor might not cover it. I want to make sure you're taken care of.
Yeah. Especially with the technologies and how much we know, how much research out there about the mouth-body connections. I would definitely questioning if my dentist did not do anything new, right? Because how can you not do anything new when you know the saliva that you swallow will also connect with your gut. Bacteria that they found in heart attack is also found in the mouth. And the brain activity, which is a lot of people now live longer but so unhealthy,
Right.
especially the cognitive ability decline.
Right.
That's all connecting to the same source, which is the mouth. And so the fact that we have the ability to really change the trajectory of the person's health, not just immediately, but decades down the road.
Yes.
I can't imagine how dentists not jump on this opportunity to make a difference.
Yes, because I was tired of being this tooth technician where you're fixing it and then you just wait for them to break and then you fix it again. And clearly it wasn't working out because people are still coming back with cavities.
Yes.
They're still coming back with gum disease. It's bleeding and inflammation still. So something has to change for them.
And I do notice that the public trust for dentists decline. Is because they trust you first, and then the same problem keep happening.
Right.
The fractured teeth keep happening, the cavities. I mean, I have so many patients come to me and say, I keep having cavity every year and my dentist would do nothing different.
Yeah.
And so either they're going to be upset or they're going to find a new dentist that understand the connection with the whole body.
Right.
Yeah. How do you talk to your patient about nutrition? Because I know you are very big on that.
Well, it's not just eat less sugar, brush more. We now look at what we look at their blood work, and so we review some of the levels like vitamin D, and we want to make sure they're taking the right supplements. Nutrition, we want to make sure they're real foods because there's so much processed foods, refined sugar foods. And so we talk about how if you eat more real foods, you'll lower inflammation and then you'll also improve the bacteria in your body and your mouth and your gut. So, yeah.
And people thinking like, why dentist asking about sleep tests?
Yes.
Or why dentist asking me like, how do you feel when you wake up in the morning? Like how that's related to teeth and gum because they're so used to dentists asking about bleeding gum and cavities.
Right.
Right. So how do you respond to patients when they ask you that?
Well, we look at the airway.
Yes.
We it's so important because if they can't sleep well, their health declines too as well. And for a lot of our patients, they thought it's normal to wake up tired. They thought it was just part of aging, when you realize that they're just not sleeping well. So we make sure that we evaluate and get those testing done for them.
Yeah. And I think a lot of patients appreciate that you asking that question and spend the quality time with them because I know that a lot of physicians did not have that opportunity or didn't have that luxury because they see so many patients or the way the system worked. They didn't get to see the patients and spend the time to ask the question. But as a dentist, especially wellness dentist, we're intentional about what we're asking because that gave us information about how we can help the patients.
Right.
And so I understand that you have an amazing team too that's supporting you in this journey. I've seen the culture of them like still having fun and educate patients together. They love learning because they're watching the training together. Yes. How did you get the team to do that?
Thankfully, it's a very growth-minded group. They love being with each other and we love taking care of each other. And so we take what we do seriously, but not ourselves too seriously. And so they see me going to these classes. They see me talk about a lot of the wellness and the classes that I'm learning from all this. And so they're just sponges. And so they're open to, I love how they've been just open to taking parts of what I'm learning and then they're implementing with my hygienist, for example, with their hygiene visits.
Yes.
So patients are just really appreciating that extra level of care.
Yeah. And the fact that the dentist and the team members and the hygienist and the assistant are all speaking the same language, I think that's create a lot of trust. Because if only the dentist know or talking about, say, ozone therapy, and then the team was like, I have no idea what she's talking about, then we don't have the trust there.
Right.
So I think it's important for dentists to go out and learn, say, go conferences like this, but go back and say, this is what I learned about red light. This is what I learned about frequency. This is what I learned about optimizing sleep and hydrations and all that. And so the first thing is you share the knowledge with them, so which is a gift. To me, knowledge is a gift. And then second is you start having conversation with patient and they hear it by osmosis, right?
Yeah.
You see patients every day and you said, you talk about nutrition, about hydration, about sleep, and they listen to it. And then when you walk out of the room, they talk to patient like that.
Yeah.
And I think that's the best leadership is leading by example.
Yes.
Yeah, role modeling.
Yeah.
And you're doing an amazing job at that.
Thank you.
Yeah. So recently you just expand and move location.
Yes.
Yeah.
So it was unexpected, but that's things.
Opportunity.
Yes, opportunity. And they always happen. These opportunities happen for us. So we're in a bigger space, better to serve our patients.
Yes.
We have more room for ourselves, even more room for training. We didn't have that room before. So it's just been really a big win-win for everyone.
Yeah. Where's your practice located? Please tell our audience because they always listen and be like, how can I reach out?
Yes, I'm in Sunnyvale, California, which is in the Bay Area. And we see a lot of tech people, but also people that are just motivated to just have healthy lives. So that's been great.
Yeah. You meet a lot of tech people here. You go down to the tech hall. That's what they call the tech hall, like 3-floor.
Yes.
With I think over 150 different company with technology that you need to check out. So I have a long list of like visiting all this company and try all this technology. So what I noticed that people that spend the extra time to work on themselves want to looking for the dentist that also spend the extra time to get to know them and to get to support them on this journey. There's a lot of Californians here at the conference.
Oh, really?
Yes, there's
I
so
didn't know
many.
that.
I know. Yeah, they would stop by the IBDM booth and we was sharing the Meridian chart and hand it out. And then we're like, wow, there's a lot of Californian here. So I know that they always looking for the best way to take care of themselves. And I think that's the highest form of ownership. Like I tell my parents, the best gift they can give for us is taking care of themselves.
Oh, for
So
sure.
we can have quality years with them, with the grandkid, travel the world with them, and really enjoy their wisdom and their present.
Yeah.
Because I've seen a lot of parents getting older and we didn't have that luxury to spend quality time with them because they not all there.
Right.
Their cognitive decline or their health spends so much time in the hospital or a nursing home. So I think this is a good reminder for us to live a healthy life, not just for ourselves, but for our children.
Yeah.
So they can enjoy us more,
Yeah.
right? And in making more memories. And I always ask all the guests on the show, if you only can choose 3, because I know we're doing so much more. If you only can choose 3 daily wellness practices, what would that be? Or what are you doing every day?
Okay. So hands down,
Yes.
for sure, strength training and movement. That is big on my list.
I admire you.
It checks a lot of boxes.
Yes.
You know, we already know all the studies.
We're doing the plank challenge
Yes.
now. 30 days.
30 days. And yeah, it's so great. I love that you are just encouraging that. And I mean, even my family, when I'm not in my best, they always will say, Mom, it's time for you to go to the gym, because they know I'm just much happier after I come back.
Yes.
So, and it gives you better skin, you know, people that work out.
And you feel good
And
after.
you feel good,
Yes.
right? You always feel so much, but no one regrets working out when they're done. The second thing would be, I think everyone needs something that is just for them, and it doesn't have to be productive or shouldn't be work related. So it could be as simple as, I like getting up early before everyone else is up and enjoying the quietness, that hot cup of coffee in front of me, and just having a few moments to myself. That's something simple I really love, and I think everyone should do. But what I would love every day would be playing pickleball. So I just think I can just be present there. There's no cell phone. There's no one asking me for anything. And I'm just having a good time laughing with friends and playing a competitive game. So that would be a non-negotiable every day if I could, but it's my twice a week right now.
Oh,
Yeah.
that's amazing. And are you in any competitions?
No. Friendly competition.
Friendly competitions,
Yes.
yeah. So I love that you move in your body a lot. And when a lot of people ask me, I'm stuck, I don't know what to do, I said, you don't have to do anything. Just get up and move your body.
Yes. Yeah.
Just go to the gym, go outside, take a
go
walk.
take a walk.
Yes,
Right.
yes. So obviously your family and your team know that you're a better boss and better mom when you move your body. And I appreciate that. The more that we serving people, the more quiet moment that we need.
Right.
And first thing in the morning is so precious.
Yeah.
Yeah. Have you tried the Danger Coffee here?
Yes.
It's
It
so
was
good.
really good.
Yes. Did you
Yes.
try the creatine and the
Yes.
MCT oil?
Throw it all in.
I'm not a coffee person, but
Yeah.
I have to tell you, every time I go to Beyond Biohacking, I have to get myself a cup of coffee.
It's so
And my team was like, why do you drink coffee? I'm like, well, the good one. Because when you look at it, it's no longer a coffee. It's actually a supplement.
Yeah.
Yeah, it's actually food
Yes.
that we need. So we need all that energy to walk the tech hall, you know?
For sure. So much.
So Jennifer, thank you so much for sharing your journey and sharing your story, and then let people know how you're implementing wellness into your life and your practice. And of course, please follow your social media. I love it. Can you share with our audience how how to reach you on social, especially
Oh,
Instagram.
Yes, you can find me at Dr. Jen Wu, DrJenwu.
Yes. And make sure you follow Dr. Jennifer Wu because she's been so good on all the physical challenges. Of course, that's what she loves to do. And then she also educating a lot on wellness dentistries and whole body health. So follow Dr. Jennifer Wu on Instagram and then her practice in Sunnyvale. And then make sure that reach out for any questions, especially in the area. And don't forget to subscribe. And we'll see you at the next episode. Thank you for listening today. Wellness starts in your mouth and includes your entire life. When you understand that, the whole game changes. Come learn more at thewellnessdentist.com. We see you in the next episode. And remember, there is always a reason to smile.